Hi everyone, I am Shahan, third year medical student. I make medical videos for helping MBBS, dental and nursing students. Today we will discuss diabetes mellitus. So what is diabetes mellitus? Here is the definition. Diabetes is a group of metabolic diseases. So it is a group of disease which is characterized by hyperglycemia resulting from defects in insulin secretion, insulin action or both. So it is a group of metabolic disease. The next one is diabetes in India. According to Indian Council of Medical Research, Indian Diabetes Study ICMR India B, a national diabetes study, India currently has 63 million people with diabetes. India represents the world's second largest diabetes population after China. This is to set increase to over 100 million by 2030. Majority of the people with diabetes, more than 90%, has type 2 diabetes. The next one is this, which is diabetes mellitus types. You can see type 1 usually occurs early in the lifetime, like the children or the teen or young adult. It is rapid onset. Pancreas produce little or no insulin. It is more severe, insulin dependent, higher risk of complication, live longer with the disease. So these are actually the characteristics of type 1 diabetes mellitus. The next one is type 2, which is non-insulin dependent, adult onset, typically obese, can occur at any age, slow onset, controlled with diet and or oral medication that stimulate the pancreas to secrete insulin, can become insulin dependent type 1. Gestational diabetes, diabetes developed during pregnancy, typically goes away after pregnancy, high risk for type 2 in later life. So what is actually insulin? Insulin is polypeptide hormone which is produced by the beta cells present in islet of Langerhans of pancreas. Insulin is a protein which is made up of two chains, alpha and beta. And remember, insulin is anabolic hormone. So right side you can see the structure of insulin. This is the picture. The next one is pancreas. Let us learn something about pancreas because diabetes mellitus is related with pancreas. 15 to 20% of islet of Langerhans has alpha cells that synthesize glucagon. 70 to 80% beta cells synthesize insulin, 1 to 8% delta cells that secrete somatostatin and gastrin, and 1 to 2% ape cell that secrete pancreatic polypeptide, which decrease the absorption of food from the GIT. So these are the cells that are present in islet of Langerhans, that is the endocrine part of pancreas to secrete different kinds of hormones. Next we will learn the symptoms of diabetes mellitus. The first one is this, which is polydipsia. Polydipsia is the medical term for excessive thirst. So the patient will have excessive thirst, large volume of water being lost through the kidney due to sugar spillage. The body is at chronic water deficit. This leads to excessive thirst. So always this diabetes mellitus patient will have a thirst. They will always feel like they are having thirst because large amount of water are lost from their body through the kidney, and that is why they will feel thirsty. This is polydipsia. The next one is polyuria. This one, in diabetes mellitus, too much glucose in the blood, hyperglycemia, tubules in the kidney do not reabsorb glucose. So as there is lot amount of glucose, so the tubules of the kidney do not reabsorb glucose, so some glucose come out in the urine, that is called polyuria. This increase the osmotic pressure of the urine. It is harder for water to leave the urine back in the body, hence polyuria, increase volume of urine. The next one is polyphagia. This is the condition where the person have enormous feeling of hungriness. So the patient will have lot amount of hungriness in his body. The body cell do not get enough glucose and sugar, and this is due to the body being usually resistant to insulin. The cells cannot absorb sugar, which makes a person feel hungry. So this diabetes mellitus patients will always feel hungry. So this is called polyphagia. So it is one of the three characteristics that are present inside a diabetes mellitus patient. Let us learn about the pharmacology of diabetes mellitus. The first one is sulfonylureas. So sulfonylureas are actually oral anti-diabetic drugs. The next one is meglitinides. Third one is biguanides. The fourth one is thiazolidinidiones. The next one is alpha glucosidase inhibitor. So these are actually the drugs. Thank you for watching. Please subscribe our channel for getting more videos like this. We have pharmacology playlist. You can watch other pharmacology videos from our channel also. Thank you.